to the Faith Action Coffee House. Thanks, Andrew. We are recording this meeting. If you'd like to kind of not be featured in the recording, we're kind of doing this for record purposes, but do get in contact with us if that's a problem for you. But just giving a bit of background to the coffee house format, we started doing these in 2020, I think it was, Andrew, during COVID. It was really a way to kind of keep in touch with different organizations, people within our network, and to really, we did it weekly initially. So it was that chance to kind of look at pressing issues, things that were coming up in the context of COVID-19 and discuss those in that kind of collaborative format. And also an informal format as well, opportunity for people to ask questions. And we decided to carry on doing them. We do it monthly now, and we tend to pick a topic that's of interest to people within our kind of broader network and sector. And so that's kind of what we do. We tend to have presentations, normally visiting people coming in, but you've got me today doing a presentation about our own work around social prescribing. So we'll take about 15-20 minutes just to kind of go through what I've got to share, and then there'll be a chance for discussion and questions and anything else at the end. So that's kind of how we're gonna run it. Great. I think we'll make a start. I've just said if you've just joined, do feel free to pop your name, where you're from in the chat, and we can know roughly where people are coming from this morning. So we've got Stephanie from London Plus. Welcome, Stephanie. Good to have you here. David Sutherland from Forge Community Church in Mid Suffolk. Welcome, David. And Maddie from Communities Together in Durham. Welcome. Yeah, hopefully there'll be a chance to hear from different people as we get into the discussion. Great. So I'm going to be sharing a presentation this morning about our work this past year on social prescribing. So I will attempt to share that now, and hopefully you can all see it. Is that coming up on people's screens? Okay. Great. So Faith Action, we did some work this past year, and when I say this past year, really I'm talking about March to March. So our kind of we work on the financial year calendar, mainly because we work with a lot of government contracts, and that's kind of how they operate. So this particular project finished in March of this year. And it was really about unpacking inclusive social prescribing. What does inclusive social prescribing look like? How do we achieve it? And really our goal was to learn from grassroots VCF organizations. And that's our real goal with this project. How can we ensure that social prescribing is inclusive? What did we do? We did 2 roundtables last summer, which gathered 25 voluntary community faith and social enterprise organizations, as well as representatives of social prescribing schemes and structures. And then we did some follow-up interviews with them just to kind of explore deeper some of the issues and themes that were coming through. So this wasn't a large-scale research project. It was really about capturing insight, and particularly, as I've said, capturing insight from those organizations that are really working at the grassroots with communities and exploring their experiences of social prescribing and their ideas about how it can be implemented and improved. We had 5 different faiths represented across the work, a broad range of organizations from the broader voluntary sector as well as the faith sector. But it was predominantly voluntary sector people we were talking to, with, as I've said, a few representatives of social prescribing schemes as well. So I've explained a little bit about this already, but just the kind of broad structure of the work with some qualitative interviews, kind of really digging deeper. And we're our findings really within hopefully the next couple of weeks. So we've just had sign off to publish. We've been working with the Department of Health and Social Care on this project. It forms part of our Health and Wellbeing Alliance work that we do within FaithAction, and we're headed to kind of publish our findings within the next couple of weeks. So do look out for that, because you'll be able to kind of dig into a lot more detail than I have time to go into this morning. So that will be happening shortly. There's a range of people on the call this morning. I don't want to assume that everybody knows exactly what social prescribing is. So just a very, very brief top level overview if it's new to you. But essentially, social prescribing is a way for people to be referred to non-clinical forms of support. So if you imagine you typically would go to your GP, you would explain what's wrong with you, you might get a prescription, you might be referred on somewhere else. Social prescribing is really a recognition that many of the things that bring people into GP surgeries, into healthcare in different settings, they're not always physical health issues. That often kind of social challenges, things like loneliness, isolation, perhaps financial challenges, can be the root cause of health concerns for a lot of people. And social prescribing recognizes that, and it's really about connecting people with different forms of support that can address these wider social challenges that the people do face. And this kind of thing has been happening for a long time. So there are approaches that go back as far as the 1980s, but it really wasn't until the early 2000s that this idea of social prescribing started to emerge as a distinct concept. And of course, in 2019, the NHS funded social prescribing link workers through the NHS long-term plan, and it's currently kind of being implemented throughout the country. So that's just an overview, and at the heart of social prescribing is the link worker role. The link worker is the person doing the social prescribing, if you like. They are responsible for giving their time to people, exploring what matters to people, understanding what's available, what kind of local picture of support looks like. They can be called many different things, so it can be challenging to work out exactly how things operate locally, because link workers do go by many names. And they can also be situated sometimes in the voluntary sector, and sometimes they're situated more in primary care, so they might be attached to a GP surgery. There are different forms and structures of social prescribing, but essentially the link worker is the person that makes it happen and does the linking up to the right forms of support. So what did we want to uncover from our roundtables? There are three main questions that we asked of people and then explored further through interviews. The first was, what does inclusive social prescribing mean to you? So if we had a blank canvas and we wanted to do this as inclusively as possible, what would that look like? So that was the second thing, was what challenges do we face in making this a reality? So that allowed us to explore some of the barriers that are perhaps encountered on both sides of, the voluntary sector, recognizing there can be barriers there, and also in the statutory side as well. And finally, what actions are needed to achieve this? What things can grassroots faith and community groups do to achieve inclusive social prescribing? And also, what can the statutory sector do? What can the NHS do? What can social prescribing commissioners and link workers do to achieve this as well? So we explored those three questions and distilled the kind of key themes that came from it, and that's formed the basis of our work. We also did some snapshot polls just to gain a sense of the temperature of where people are at, and we wanted to know about awareness of social prescribing, and also about access to social prescribing. So the first question we asked in the poll was, to what degree do you agree with the statement, people in my community are aware of social prescribing? You can see that most people disagreed with the statements, and most people felt that there wasn't an awareness in their community around social prescribing. Some three people either agree, disagree, people agree, a bit of an even spread there. But we talked about access, so people might. It was a bit more of a negative picture. So overwhelmingly, most people disagreed with that statement. Only three people agreed the people in the community knew how to access social prescribing. So it does paint an interesting picture there, and really does show that this is something that is being rolled out. If this is something that isn't available for everybody as a core tenet of personal care, it's there in a long-term plan, yet there isn't this awareness, and there is this, even if there is awareness, and something really needs done. Just that this big sample does represent a bit of a snapshot of people that we were engaged with in this work. Just run through some of the themes that emerged as we asked this question. The first thing that really came through was this idea of it being faith and culturally relevant. So is social prescribing something that people can look at as a pathway and think, wow, that's for me, that makes sense to me. A leader of a mosque in North London who we spoke to said the face of any service needs to be something that's recognizable, so people can relate to them. And really our conversations really reflected that power of a service that people can look at and think, okay, I can relate to this person, I can recognize myself in this. And so that really points to recruitment, perhaps, of link workers and the kinds of people that are involved in those navigating roles. Are they coming from communities? Are they coming from those communities that are perhaps experiencing the most inequalities, that are perhaps struggling to access primary care? Or are they perhaps more reflective of the mainstream? And really kind of asking those questions about cultural relevance. The second thing was around awareness and understanding. So someone made the comment that social prescribing, my community will not recognize that. We have so much faith in the medical field, and that feeling that often among communities there was this recognition that sometimes people do want to see a doctor, and actually a referral to social prescribing might not be what they want. And this really speaks to a kind of greater awareness raising, maybe helping people understand the value of that holistic approach to healthcare. But also we recognized that there was a need for greater awareness on the part of GPs themselves. So within the healthcare system, do they really understand what social prescribing is? Some link workers were reflecting, actually, we feel that sometimes we get referrals because these are just patients that GPs aren't really sure what else to do with, and so they come into social prescribing. So right across the board, this sense of it needs to be something that people are aware of, people really understand the value of it, and why it exists. The third thing was really about access, unsurprisingly. So is it something that's accessible, particularly for those who may struggle to get to primary care in the first place? Again, someone made the comment, to get to a doctor in the first place is very difficult. But even to be able to speak to the doctor and say, I've been having quite a few low days recently, it's like they're going to take my children away. So really recognizing that there are barriers to get in the door in the first place. But even when you're there, is there the sense of trust, that ability to kind of be open with the healthcare professional that can then lead to the right kind of pathways and the right support? The people we spoke to, the communities we spoke to, really didn't want to be seen as hard to reach. And so there was that reflection that there needs to be a kind of a proactiveness on the part of the system to really outreach to communities and ensure that no one is left behind, and that there is really access for everybody. The next point was really about it being focused on the whole person, and recognizing that faith and culture needs to be a part of that holistic picture, that when questions are being asked about what matters to people, is faith being included in that? But also with that, recognizing that we shouldn't be making assumptions. So a rabbi said to us, it's not making the assumption that just because somebody's Jewish, they'd want to come to our synagogue. And the reverse is also true. Just because somebody isn't a person of faith doesn't mean that they wouldn't want a referral into a faith-based setting, but really recognizing it's about listening to the person, what they want, not making assumptions, but asking open questions, and really being willing to refer people on based on need. Next, we heard about involvement of communities. So at that point about co-production, are these services and pathways being designed in collaboration with communities and grassroots community groups who know their communities best? People reflecting that we haven't been involved in the design. A lot of what we do is social prescribing, but we feel like we haven't been engaged. So again, recognition that there needs to be engagement right at the beginning of that process, not once it's all set up. And finally, a point about sustainability. And often this did come down to funding and finance, but the need for involvement of communities to be long-term. And a really telling comment that someone made was that, the people we're supporting are tired of being a project. They're tired of being part of a pilot that pops up and then disappears. This will run for a year and then we're gone. So how is funding looking to the long term? Are these schemes and projects long term, or is funding short term? And really to involve some of these communities that face the most inequalities, there's that need for long term investment and long term funding. So those are the key themes that came through. In terms of barriers, I won't go through all of these, and I'm fully aware that this does break PowerPoint etiquette in putting a lot of information on one slide, but just a snapshot really here of some of the things that came up that might challenge this achievement of inclusive social prescribing. It's really interesting because as we went through what we heard and started to draw out what are the kind of barriers that we're identifying here, we realized that they really do cut across both the communities, so barriers that are located in communities, but also in the system. So where we looked at language, for example, there's a recognition that sometimes faith communities and community groups might use terminology at odds with the health sector that might sound perhaps less professional to the health sector. There might be practical language barriers, need for translation. But also within the system, there was a recognition that some of the terminology that can surround social prescribing, even the term itself, can sound very clinical and may not seem relevant or may not seem appropriate to faith communities or community groups. There was a recognition that some people associated the social of social prescribing with social services, and were they being referred into social services, and that fear and stigma that might be associated with that. So again, this recognition that on both sides you have potential barriers there around language, and that cut through right through gaps in awareness, capacity, geographical inequality, questions around access, and negative perceptions. And just to kind of touch on that last one again, we found that sometimes within communities, we heard there were negative perceptions of healthcare services, maybe a lack of trust in healthcare services based on negative experiences. There might be stigma around getting help for social needs or mental health needs among communities. But equally in the system, sometimes there were negative perceptions around the faith and community sector, perhaps around lack of professionalism, perhaps around fear that faith groups might proselytize or use public money to try and win converts or things like that. These were all things that we heard that form barriers and these kind of negative perceptions. So really a recognition that there's a lot of things that could be unpicked here if we're to really achieve the potential of inclusive social prescribing. And again, a lot more detail on this in the report, so do look out for that when it does become available. So finally, recommendations. What did we land upon in terms of some key actions that can start to address this and start to make a difference? Again, this is just a snapshot, but for providers, there was really a recommendation around language. So that really came through strongly. Is there an opportunity to reframe language surrounding social prescribing schemes so that it's accessible? And we're not suggesting here that we do away with the term social prescribing. We recognize that that's not going to happen. But perhaps at that local level, that hyper-local grassroots level, where there are particular opportunities to outreach with certain communities? Is there an opportunity there to think about the language that's being used and co-design a vocabulary that isn't going to alienate and will improve access there? Also, we looked at kind of visible communication pathways. You know, if a faith-based organization wants to get in touch with a link worker, wants to get involved in social prescribing, clear to them where to go? You know, is it easy to find that information? We heard stories of faith groups searching for months and months and months before they even found their link worker, and it was just a chance conversation they had one day that put them in touch. There needs to be very clear communication pathways that when someone does want to make that link, that they're able to do that. And then within wider systems, to the importance of broader kind of community representation within things like VCFSE alliances at that kind of higher NHS system level. But also, is there opportunity for funding of community champions models, for example, to make social prescribing work? We saw really good examples of that during the pandemic. Community champions funded to disseminate messaging and to improve trust. Could that be applied to social prescribing? Is there funding available to do that? And then finally, with grassroots VCFSE organizations, a real recommendation was around collaboration, not working in silos, but across faiths, across different kinds of organization. Are there opportunities to work in partnership that might attract new funding and facilitate more effective social prescribing? So just a snapshot there of some of the recommendations that have come out, but of course there are many more that we've detailed. So where are we taking this work next? So we're going to be launching this report in a couple of weeks. We're really interested in embedding some of these findings and recommendations on the ground. So we're going to be beginning a local pilot project in Tower Hamlets shortly. We're just beginning that at the moment, really exploring this concept of social prescribing champions and working with faith communities at that local level to train up champions that can almost be advocates within their own communities for what social prescribing is and how to get involved. As part of that, we're going to be doing a workshop to kind of co-design a vocabulary and kind of work with people to think, how do we best describe what we're doing? So we're interested to find what comes out of that. And we're going to be evaluating it as well. And you'll find our kind of findings and evaluation from this particular project around about this time next year, I'd imagine. So if you're interested in hearing more about this or following our work this year, do please get in touch with me or a member of the team, and we'd be happy to kind of keep you up to date on that. So moving on now to questions. I feel like I've talked for enough. Those are just a few of the findings from this work, but very happy to answer any further questions on this. And also really interested to hear from all of you on the call today. What best practice have you seen in encouraging inclusive social prescribing, realizing there's been a huge amount of work on this across the country? We are not the first. We're just adding something to the conversation. But what best practice already exists that can be learned from? Do any of these findings resonate with you, with what you find, whether you're a faith-based organization or from a different sector? And finally, how can we drive action around these recommendations? Did any of those recommendations resonate with you? Is there anything that you can think of that might make a real difference to implementing these at a local level? So those are the questions. That's my presentation done. Hopefully there was something of interest there. And over to you guys, really. I'm very interested to hear, first of all, if you have any initial questions for me, but also following those final questions, which I will try and pop in the chat, any other further reflections on those? Reverend James, I think I saw your hand.
Yes, I did.
And I saw some.
I did. Yes.
Just hand up. So I'll go.
Actually, it's actually a comment about the presentation, which is so heartwarming. You find out even in our faith settings, people get to trust their leaders, and then they oftentimes they don't know where to go. The help may be there, but they don't know. So I think the social prescribing is actually very important in every community, especially our community. And I find it so useful with the work we've done with Faith Action that it is actually the people are signposted to the right place to go, and which ordinarily they don't realize it's possible. So social prescribing is actually is very important. And like I said, Poplarca started this so many years ago, and if it fizzled out, but it's so heartwarming that you are piloting timelets, and I'm in.
Great, thanks, James. That's really, really interesting. And what you mentioned there about the trust, I think, is definitely something that's key, isn't it? The importance of those faith and community leaders holding that trust, and if they can be engaged in raising awareness, I think that's incredibly powerful, isn't it? I'm just looking also back through the comments and see that my connection seemed to be a bit interrupted. I do apologize for that. Unfortunately, my presentation covered my screen, so I couldn't see people's reaction as I was going. So hopefully you caught enough of that for it to be helpful, but we will circulate slides as well. I can see a few more hands up. Sandra, I think you were one of the first as well. So if we go to you next.
Okay, thank you. I think it was a useful presentation, but I think it's possibly time to, and I'm not even sure if I'm going to use the right words here, relaunch social prescription, because while I think, you know, people on this call and others may know about it, I don't think the general population do, or what it means or what they can get from it, what they can get and give to it. Secondly, I think that and having just finished working for a council for many years, it has become a council activity or a you know, and people don't see that actually this is very much from the community and can be really useful and can help people get involved in their communities and then help themselves as a result, you know. But if you tell somebody, oh, we're going to help you, then they don't really want to be. I don't want to be involved in something. Oh, I'll help you. They say, well, actually, you can help the community. You can help do this, and then suddenly they're in a different frame of mind. And as to the champions, good idea. But we've got so many champions of everything right now. Please think of another name or a different. You know, I've been a COVID champion. I've been this champion, that champion. I'm a table tennis champion. You know, you're saying, actually, let's think of something just slightly different that would kind of make people think, oh, okay. And I have no idea what that word may be, but I'm just so, you know, so fed up. I think of the word champions, even though Luton hopefully will become champions of the first the championship in the next few weeks. But you know, it's just, I think the wording is really important, I guess is what I'm trying to say. And what social prescription means in 2023, as opposed to what it meant 10 years ago or even 5 years ago, and how COVID changed that and everything else. But I don't think we've brought out a new meaning of it.
Yeah, no, really, really helpful, Sandra. Thank you for those comments. I think that's, yeah, that broadly reflects a lot of the themes that I think were coming through our work. That sense of people feeling a little bit maybe left behind, that this is running on ahead, but hasn't necessarily been involving people, and that sort of set that groundswell of we're a part of this. It's not just being done to us. And yeah, take your point about the champions as well. I think there is a need to consider the language and how are we packaging it. So we'll yeah, definitely consider that and take it away. And any thoughts welcome as well from other people here today. You know, do you have any other ideas about what this could be called if we're talking about people being advocates for social prescribing among their communities? is there a way that we can articulate this that's perhaps more relevant? Now I've got Joy and Barbara. If I could go to you both next. I think Joy may have been first. You're at least first on my screen. No, Barbara was first. Okay, we'll go to Barbara first then, if you'd like to come in.
Oh, pushy person I am, aren't I? I'm so sorry, Joy. I hope you don't mind that. Sandra, what you've been saying is rings very true. I'm very involved. My company is Care for Carers Community. We work with PAs, carers, organisations. We're a community micro hub working with Essex County Council. Now, I'm on numerous meetings day in, day out. I have only seen a social prescriber way back in COVID times. So I think it's going to be for me after this meeting, and thank you for this, that I need to push out again. I've tried before. I'm used to working with GPs. I know GPs on the whole, and this is a sweeping statement, won't have the time or the incentive, particularly to guide people towards the social prescribers. My experience of social prescribers in my area is they're not quite sure what they're supposed to do either, and the best use of their time. I think it's a massively helpful thing to have, but I think they must collaborate with more of the organisations around their areas, and work a bit innovative, because there's lots of organisations. And what my main question is, how is social prescribing measured? That's me.
Thanks, Barbara. Really interesting thoughts. And yeah, that question around measurement and evaluation is such a key one, isn't it? And it's not an easy question to answer, because it raises a lot more questions, like who's doing the measuring, and is it the destinations that are measuring the impact, or is it, there's lots of questions there to grapple with. But I think there does need to be some kind of
the people that can measure this are Healthwatch. UK. If none of you know about Healthwatch, I hope many of you do, but they're a national company, organisation throughout the UK, and they are particularly good at measuring outcomes, particularly in the NHS settings. I haven't heard that anything's going on about that at the moment, but talk about titles, Sandra. I'm an ambassador for Healthwatch, so I quite like that. But I do find Healthwatch do some fantastic work. So
great. And we, the Barking Dagenham Health Watch actually sits within the FaithAction team, as a little fact there. So yeah, we very much kind of champion the value of Health Watch in communities, and yeah, definitely something to be aware of. Joy, if we could come to you next.
Hi. I wanted to try to underline whoever said the slides are just absolutely amazing. I am from a network in West Birmingham, network of community organisations that are working to reduce health inequalities in partnership with the locality partnership. And we are very aware that social prescribing could be better where we are. It definitely could be better for adults, and it's pretty non-existent for children and young people. So we have a meeting that we've organised with anyone that we can pull in this sector. And echoing someone's comment, it has taken so long, nearly 6 months, to even find out who we should be talking to. But we're pulling these people in on the 25th, and I will speak to you at another forum, Jeremy, but I would love to either for you to present these slides or for you to allow me to, because I think it's so many excellent points, especially in the barriers and what could be done better. I wanted to try to address a little bit of your questions, just to say of a good model that we think is coming on here. One of our member organizations, which is is aligned to a practice. So it's a faith-based member organization. We have all VCFSE, but it's aligned to a GP practice that was established on Christian principles. And they are actually very likely to become the social prescribing arm of that GP practice. And so they're already hooked into a really wide base of community organizations. And I think that not locking up social prescribing with one prescriber provider is a really good thing, because that's one of the big challenges we have, is that there are a couple of what we feel are just really sort of convenient social prescribing solutions here that don't motivate anyone involved to go any further than those kind of one or two really big organizations that also can deliver the prescription, if you like. So we'd like to see a much wider base of delivery organizations, but actually also with those able to refer into the system more easily, because they are often the first point of contact. And that speaks to the point of, if they're not in the GP system, we already know their need, but we can't get any further with it. So all of those points resonated with me pretty much. But so I said about the meeting, we're also piloting, and have been asked by our PCN in one of our areas to pilot what we call neighborhood navigators. So essentially, we are the de facto social prescribers, because we connect people coming out of a particular clinic with any wider care that they need in the community. But this comes with absolutely no funding. And I suppose that the whole point of evaluation, sustainability, how you prove the worth, how you become part of the system, that is a really big challenge. And I would love to hear from anybody who feels that they've cracked it, because we're really not cracking it at the moment. But we've got this meeting on the 25th, and we're hoping to at least make some connections and do some introductions, because I can't remember whether it was James who said, absolutely, our social prescribers that we've talked to say, well, we wish we knew more people in the community, but we don't know who to talk to, so we're a network, so hopefully we can help with that. But really echo a lot of Barbara's comments about the evaluation as well, and we'd just love to have a model. So yeah, thanks a lot.
Great. Thanks, Joy. Really insightful points there, and glad you could join today, and that it was helpful. We're happy to share the slides and perhaps chat further about how we can support that work on the 25th, if that would be helpful. But yeah, really interesting points there, and particularly you mentioned very briefly at the beginning about children and young people, and I'd be keen, maybe not for this session, but that was something that did come up through our work as well, was the importance of actually whole family approaches to social prescribing. We know that we've done some work with Bernardo's as well, who've been looking at social prescribing and whole family approaches, and actually particularly from the communities we were connecting with, there was that recognition that sometimes it's not just an individualized thing that you go to your GP and receive a referral, but perhaps it's those broader networks of support, families and friends that can also be a part of that picture. So interesting to consider there. But no, really great insights there, and we're going to capture those and take those on board as well. Got two more people with hands up. So Ahmed, I think you were first, and then we'll come to Stephanie from London Plus. So Ahmed, take it away.
Hi, my name is Ahmed, as you know. I'm working with the DWP, but I also work in the community. I'm sort of co-located. I work with the Blackburn Council, so I'm up in the north for my sins. So the thing is, the community connectors and the social prescribers here do an absolutely fabulous job. I cannot speak highly enough of them. And I don't know if it's because it's a small localized town that we have, but they do a fabulous job. And the way that they get their referrals to the work that they've done is absolutely brilliant. And honestly, I've worked with them, and I still continue to work with them, and I've never heard anything negative about them. And in the community there, with the dynamics of the community here is predominantly of South Asian and of Muslim background as well. And there's obviously various backgrounds of the world, but we work with everybody and within those different communities, and understand some of the challenges there as well. And it is just honestly a breath of fresh air that they have, because they do a lot of handhold working with them, working with the NHS and working with the doctors, working with all the voluntary sectors and things like that as well. So I just wanted to really reflect on some of the good work that they're doing there, and I can even put you in touch with some of the leaders in there, so you can get some ideas of how they operate and things like that. But it is absolutely brilliant. So I can't speak highly enough of them in Blackburn. I'm not so sure how it's working in wider Lancashire, because it is a unitary authority here in Blackburn. I've not, I think with my colleagues, they cover Carlisle and they cover Lancashire, and they're really impressed about the way that we work in Blackburn as opposed to their areas as well. So yeah, I think it is a bit of a benchmark, and it would be good to look at the model and the way that they work. So that's all of me.
Fantastic. Thanks, Ahmed. Happy to be put in touch to hear more about that. And it can be a feature when you're looking at asking these questions around barriers and challenges, that it can become a very negative conversation. But we know that there is a lot of good stuff happening. Although, you know, there are challenges in many parts of the country, there is a lot of good practice and many very hardworking link workers doing amazing work. So I think it's really good to reflect that as well. Stephanie, if you'd like to come in.
Yeah, I think it was just, I want to see if my video will work. It's been playing up all morning, so I'm sort of going to try and, oh, there we go. Can't guarantee it will stay, but I just kind of wanted to comment on a few things that have kind of been raised in terms of like system-wide stuff that might be going on that might be useful for people to know about. So one of the things is, it's true that the GPs do struggle to have time to understand what social prescribing is about. So some research and some toolkits are about to be launched quite soon, I think, by NAVCA around how to actually engage with GPs for link workers, and also the value of social prescribing, the value of the voluntary sector and faith sector as well, that people might be able to access and use if they're going to talk to their GPs and link workers. The other thing I think it's really important to recognise, which may not kind of come through with the system very often, is the system itself doesn't know how to evaluate social prescribing. And the National Academy of Research around the gaps and what works, although we know in the voluntary sector what's working. That's what's really frustrating, I think, is trying to get the NHS to understand that and work with that. And we're trying to do some work with that in London Plus across London. I can only speak for London, but in one integrated care system in North West, they are actually setting out what they're calling a digital scoreboard for social prescribing, which will theoretically measure the impact of what's happening for the activity from the activity level. And they're the only system in London that I'm aware of that are actually focusing on that. And I think even though we've got the NHS Common Outcomes Framework, if you look at that document, there's very little detail around that. So I think it's just important to kind of realise that there isn't a model at the moment. They're working on it. They don't really know. They're still trying to decide. And that takes time. And because the integrated care systems are brand new, you know, only not even a year old yet, and everything's kind of being discussed around that and what that looks like, this side of it is not terribly important to them, although they keep on talking about personalised care. And that's where social prescribing obviously sits. So I suppose it's just kind of trying to reassure people really that the reason why you don't know how to evaluate it or what it looks like is because nobody knows yet, and it's being worked on. So it's not like there's a secret model that everyone's using or is aware of, and people at the grassroots, which is sometimes how we can feel as we're completely forgotten about and things. They're still working it out. And I think the key thing is probably to try and get in contact maybe with your voluntary sector alliance leads to make sure that some of those conversations are happening between the voluntary sector and the NHS, so that you can influence about what you think is important about social prescribing activities and the value that it brings. Because it needs to be a different thing than a randomized control trial, and all that value and experience that we have should be fed into the system and the design and the delivery, and particularly the outcomes and how it's being measured, because now's the time to do that. So those are just some thoughts that I have, in case that's helpful.
Brilliant, thanks, Stephanie. Really, yeah, really helpful to get that perspective on some of the stuff that's happening on the system side. And I can see you put in the chat an FAQ for people looking to get involved in social prescribing. So do check that out, that link that Stephanie's put in the chat, because I think that's going to be really helpful for anyone that's particularly within that London area, kind of looking to get involved in social prescribing. Great. I just want to invite anybody else who has any questions about anything that's been said today, whether it's on my presentation or anything that's been mentioned. There are any questions, so do feel free to jump in and make a comment at this point. Great. I think clearly everybody's said everything that they want to say. Yeah, do feel free to do that if need be. Andrew just popped our contact details in the chat, so we are very happy to be contacted and speak in more detail about this. So please drop us a line if you want to hear more about our work that we're doing this year, how you can get involved in that. Of course, this report and these findings will be coming out very shortly as well. So do look out for that. Otherwise, just to say thank you again so much for coming and contributing some really rich discussion as well coming out of this, and things that we can take away. If you mentioned anything that you want other people to know about, again, pop it in the chat while there's an opportunity. Or get in touch with us and we can circulate it afterwards as well. That might be easier before we kind of lose access to the chat. But I think that this brings us more or less to a close. So just thank you all for coming, and love to continue this conversation. It's really important work, and lots of great stuff happening, but equally a long way to go for all of us as well. So thank you all again. And hopefully we'll be in touch soon.